Hello, dear friends and family of the Healthy Living with Van channel. Today, we'll be talking about a very familiar issue that still leaves many people wondering: astigmatism, nearsightedness, farsightedness. Is surgery really necessary? Nowadays, many people think, if my vision is blurry, I'll just get surgery and be done with it. But in reality, surgery is only one option among many. So when do you really need surgery? And when is it enough to simply wear glasses or change your daily habits? That is what I want to share with you today. What are nearsightedness, farsightedness, and astigmatism? Nearsightedness: myopia. You see clearly up close but blurry in the distance. This happens when the eyeball is longer than normal, or the cornea is too curved. Farsightedness: hyperopia. The opposite, you see better far away, but near vision is blurry. It occurs when the eyeball is too short, or the cornea is too flat. Astigmatism. Images appear distorted or blurry because the cornea is not evenly round but curved unevenly along different axes. Think of the eyes like a camera. If the lens or film is out of alignment, the image becomes blurry. That's exactly what refractive errors are. Why are refractive errors becoming more common? In the past, very few children suffered from myopia or astigmatism. But today, many students, office workers, and even young children in elementary school already need glasses. The main reasons include excessive screen time, phones, computers, television, long hours of study or reading with little outdoor activity, lack of natural light exposure, genetic factors. In fact, surveys show that in major cities, up to 60% of high school students suffer from myopia. Clearly, refractive errors are a disease of modern times. Daily inconveniences of vision problems. Those with myopia, hyperopia, or astigmatism face challenges such as difficulty seeing road signs, risk of accidents, eye strain and headaches when reading or working, reduced learning or work efficiency, aesthetic concerns. Many dislike wearing glasses. Most importantly, in children, uncorrected vision problems may lead to amblyopia, lazy eye, which can become permanent. Do you always need surgery for refractive errors? The answer is no. Not everyone with myopia, hyperopia, or astigmatism needs surgery. In fact, most people can see well and live normally with eyeglasses, contact lenses if appropriate, lifestyle adjustments. Surgery is only recommended when vision has stabilized, usually after age 18. The patient genuinely wants to live without glasses. An eye specialist confirms the patient is suitable. Common surgical options today. Modern technology offers several ways to free the eyes from glasses. LASIK. Laser creates a corneal flap and reshapes the cornea. Femto-LASIK. A more advanced, safer, and precise version. SMILE. A minimally invasive procedure without creating a flap. ICL. Implantable contact lens. An artificial lens is placed inside the eye, used when myopia is very high or the cornea is too thin. Each method has pros and cons, and only a doctor can recommend the most suitable one. When is surgery not appropriate? Surgery is not recommended for people under 18 with unstable prescriptions, pregnant or breastfeeding women, those with other eye diseases, thin cornea, keratoconus, glaucoma, patients with uncontrolled diabetes, severe systemic diseases, or immune disorders. In these cases, glasses remain the safest and most effective choice. Patient stories. I once had a young man in his 20s with over -8.00 myopia. He was eager for surgery, but upon examination, his cornea was too thin for LASIK. I recommended the ICL procedure instead. Another case. A 55-year-old woman with mild farsightedness. She wanted surgery because her friends said it was convenient. But after careful consultation, I explained she only needed simple reading glasses, no surgery required. She sighed in relief. Thank goodness, I was nervous about the knife. These stories remind us, not everyone needs surgery. The key is to understand your eyes and follow your doctor's advice. Benefits and risks of eye surgery. Benefits: free from glasses. Clear, improved vision. Convenience for daily life and sports. Risks: post-surgery dry eyes, night glare or halos, rare complications like infection or reduced vision. That's why surgery should always be a carefully considered decision. Eyeglasses, the safe choice. Eyeglasses remain a safe, affordable, and effective option, inexpensive and easy to replace. No direct interference with the eye. Suitable for all ages. The key is proper prescription, correct pupil distance, and regular eye exams. How to care for your eyes with refractive errors. Whether you choose surgery or not, eye care is essential. Read and write in proper lighting. Follow the 20-20-20 rule when using screens. Spend more time outdoors, especially children. Eat more vegetables and omega-3 rich fish. Drink enough water and sleep well. A philosophy for the eyes: not everything needs surgery. In medicine, surgery should only be used when truly necessary. Our eyes are no different. Surgery may bring convenience, but wearing glasses isn't such a big burden either. Some people choose surgery, some choose glasses. Both are valid, as long as they suit the individual. What truly matters is how we care for our eyes daily. Many patients I meet suffer from blurred vision, dry eyes, cataracts, or retinal degeneration, not only due to aging, but also due to harmful daily habits. Let's take a closer look at 8 habits that silently destroy our eyes, and learn how to protect them. Too much screen time. Reading, using devices in the dark. Frequent eye rubbing, not wearing sunglasses outdoors. Poor nutrition, lack of proper sleep. Smoking and alcohol use. Skipping regular eye checkups. Each of these habits quietly damages our vision over time. Changing them can protect our eyesight for life. Closing. Dear friends, our eyes are the windows to the soul, how we see our family, nature, and the beauty of life. But they are fragile and easily harmed by seemingly small daily habits. Always remember: limit screen time. Read and work in proper lighting. Stop rubbing your eyes. Eat a balanced diet. Get enough sleep. Quit smoking, reduce alcohol. And don't forget regular eye checkups. As for the question, astigmatism, nearsightedness, farsightedness, is surgery necessary? The answer is number. Surgery is an option, but not the only one. The most important steps are: understand your own condition. Consult a specialist. Care for your eyes properly. Don't rush into surgery just because it seems faster. Choose the safest and most suitable option for yourself. Thank you so much for listening. If you found this video helpful, please like, share, and subscribe to Healthy Living with Van so we can continue this journey of protecting our health together.